talking about the bag on the outside. Or I'm talking about the attachment to the tray.
Right.
That's not sterile.
No, but neither
it's
is
not
their
sterile,
tray.
but neither is the outside part of the tray.
Okay, so you just emphasizing like, and you're going inside.
Yep.
Okay.
Then when you're ready, you can take the bag off. Okay, I'm going back down to section. Just going into the middle. Again, how long? How far do I go down? Yep, so I feel resistance, and then I'm suctioning intermittently on the way out. Most of the time, you're not going to go down any more than 2 or 3 times. You never continuously suction someone. Now that I've said that, there was one exception in my lifetime. Had a patient who aspirated, and we put a tube down, and I mean, it was just pouring out. He had aspirated so much fluid, it was pouring out. For him, we continuously suctioned him. So we're also giving him ventilations in between, but we were constantly suctioning him. You're going to clean this off. Then we're going to go ahead and turn everything off. We'll put the patient back on their normal oxygen because we're going to start trach care. So you're going to go from one procedure to the next, but before we go on to that, I'm going to clean up my area.
Chris, real quick, did you say how high to put the oxygen
I was
level
just gonna ask that, cause it looked like it was
when you
up
bag
there.
them?
At least on 10.
Okay.
10 liters per minute. It depends on the patient. You're going to have, this bag will fill up. If they're requiring a lot more oxygen, or you can tell by the way the work of breathing that they're doing, you can turn it up to 15 even. So it's anywhere from 10 to 15, like a non-rebreather mask. But you know that bag at the end, if you're completely deflating that constantly, you want to turn that oxygen up.
And can you repeat one more time? How do you determine the size of the catheter?
You look, come on up here. She has an 8 French trach. So you multiply that 8 times 2. The largest you're going to use is 16.
Gotcha, okay.
And the catheters get larger as they get bigger. So 14 is acceptable. Because it's less. Like an 18 you couldn't use on this patient.
Right.
20 you couldn't use on this patient.
But anything below 60.
Correct. You could use on the patient. You're gonna, so you pre-oxygenate them for at least 1 minute before you start suctioning, and you pre-oxygenate, or you give them more oxygen again at the end. And then you'll put them back on their normal oxygen, if they even have it. Some patients are gonna come in, they're just on room air. So you just supply them with oxygen while you're suctioning them, and then afterwards, and then you're done. Then they go back on room air. As long as their pulse ox is good, their heart rate is good, so you're gonna check that. And I always put this in the back usually, is where you'll find that. And then I will reassess my patient. So you need to re-listen to lung sounds to make sure that your suctioning was effective. Ask the patient if the suctioning helped, ask them if they're breathing easier, and then you're gonna go on to trach care. Because we checked both procedures in the book before we came in here. Questions so far?
So just 10 seconds of suctioning.
No more than 10.
No more than
You're gonna go down. I start to count as soon as you come out.
Times 3? Did you do it 3 times?
I did it 2 times.
Oh,
I said you could do it as 2, 3 times. You never wanna go down more than that.
okay.
Because again, you're stealing your patient's oxygen. Some patients are so sensitive that when you're watching their pulse ox, you'll see their heart rate start to drop. They'll become bradycardic because they don't have enough oxygen. Especially kids.
They complain of air hunger, get very anxious, they complain of air hunger. Do it too.
Yep. So you don't want to do it for too long. What'd you call that?
Like air hunger, they feel like they have no air going, and they get very anxious. A lot of your patients on trachs are very anxious, so you have to be there to reassure and calm them down while you're doing it.
I would be very anxious. What does this mean?
Your COPD patients especially.
Exactly, yeah.
Because they're short of breath all the time. I remember walking in the hospital one day and this gentleman came through. He looked like he's so short of breath. And I asked him if he was doing okay, and he said, yeah, I'm fine. This is my normal breathing. I went, normal breathing? I mean, the guy was gasping. It's
Or
normal.
with COPD patients, you have to like actually work with your patients, calm them down like you do with someone who's, it's almost like a Lamaze therapy, I always say, like, you know, you're into some deep breathing, relaxation. I don't know, Chris, do they give them Xanax now? Like, do they have to calm
We
down?
did when I left the floor.
Right,
yes.
because back in the day when I started working initially as a nurse, they would not give them anything like that. They thought not to waste their respirations out, but then they realized after they gave us like that, the patient was able to take deeper breaths and able to get more oxygen and more calm. So,
Now for this one, you guys are gonna wanna come closer and watch. Now we're doing trach care, and this one gets to be a little bit tricky. There's a lot of steps to this. It's a simple procedure, but again, it just takes a while to learn. You're gonna keep the pulse ox on your patient. You're gonna wash your hands between procedures. You're gonna make sure that you have the right size equipment, that the packaging is not damaged, that it's not expired. And this is 319, so this is all good, and I have my sticker on, and it's Bobby Joe, and I know I'm doing the right patient. So what you're going to do first is you're going to open up your equipment. And this is one, again, if this got wet during your other procedure, you're gonna wanna wipe it down. It's a little wet right there. So you wanna make sure you have a dry table, because this packaging is gonna go on top, and if you don't dry it down, it's just gonna get wet and contaminated. So never turn your back on your sterile field. Make sure your table is at waist high so that you don't contaminate. Remember, anything below the waist is contaminated. This one is a lot tricky to open up. Not even gonna lie. You're gonna have some issues when you go to open it up. But the first thing I'm gonna go ahead and do is I'm going to go ahead and remove her, somebody has gloves here, I'm not sure if these were used or not, but I'm gonna go ahead and use them anyway. First thing I like to do is remove my trach dressing. So if they don't need to be on oxygen, I will go ahead and remove the oxygen so that that is out of my way. I will take off the dressing, and you're looking at the dressing for what? Coca, which is?
Color, consistency, amount.
And that will go in the trash. Then I just look at the site, and I'll remove my gloves, and I will wash my hands, and then I will start to set up my equipment. Again, do not turn your back on your sterile field. So what I'm going to do is I'm going to go underneath the hair, and I'm going to open this up. Notice this goes top and bottom. So I'm turning it a little ways so that I don't contaminate by going over my sterile field, because you cannot go over your sterile field as you're opening it. So I'm going to grab the side here. And you cannot let it close on itself. If it closes on itself, it is contaminated, right? Inch all the way around is contaminated, so you can touch in that 1 inch. That would be contaminated. So you cannot let that happen. If it happens, what are you gonna do?
Get another one.
No. I mean, in real life you would, but.
Yeah.
Let you know.
Let you know that we contaminated.
Yeah.
Or if this closes like that, you can always say, that's my contaminated area, and just leave it and keep going. Or the other thing, this is underneath, so I'm putting pressure on the trays, and you'll see what I mean as I open this up, as I'm opening this, because it's catching on the tray itself. And you don't want that to happen.
I already don't like this one.
This one is very, very tricky. Again, you want to get it as flat as you possibly can. We're not going to leave this up like this, because that will create a problem.
And that one folds
That one's
right
just
down.
contaminated again. So we'll just leave it closed for this time. Alright. We need to move this over. We have to grab our, and this one doesn't look like it is wrapped correctly, because that one is folded everywhere around.
Yep. It's folded inside.
So I'm not even gonna try to put that on just yet. I'm gonna put one glove on, and then I'll put it on. So what you're looking at is your sterile water, making sure that you have the appropriate stuff. You could even use sodium chloride for this, that would be fine as well. Not expired, there's nothing floating in it. Remember, you need to do 3 checks on this when you grab it out. I just kinda just brought it in here. We're gonna open this up because we are going to have to pour it, but we're gonna have one glove on, so it could become a problem. So I'm leaving the top on, but I wanna make sure all I have to do is pull it off. And I want it somewhat close to me. So again, I'm not turning my back on my sterile field, but I do need to set my sterile field up. So I'm gonna remove my gloves from the wrapper. I'm going to open them up, always looking at your sterile field and your patient, making sure they're doing okay. Normally we'd be talking to our patients at this time. So we're opening up our gloves. Again, make sure your wrapper is as flat as possible because it will close on you, I guarantee it. I'm going to put on my dominant hand. Yep, dominant hand. So up and back. This one you got to get on right. So practice, practice, practice. If you wear a little bit bigger glove, it'll be easier to put it on. I'm going to go ahead and open this up. And I can grab it with my other hand because
1 inch.
Yep, keep saying it. All the way around is contaminated. Then as soon as I get close, I let go with my sterile hand, and I'm just putting this down with my dirty hand. Inch all the way around is contaminated. So now I need to separate my trays. So while I'm pouring the saline, I want to make sure that this is close to the edge. I can move it later. But all I'm doing is just opening up my trays, and I'm setting them down. Again, an inch all the way around is contaminated. So I'm moving this down. Now I need to pour my solution. So I'm removing the top, putting that down, palming my label, and I'm going at the shortest angle to pour fluid in both my trays. My hand is staying above my waist, my sterile hand. Put this down, put this up, move this back. So I'm ready to put on my second glove because I want to rearrange everything, but I want 2 gloves on so I can use both my hands. So up and away. Thumb is out. You're hitchhiking. Watch how your fingers are moving so that you don't contaminate them on something else. And now you're ready to go. Now I have 2 sterile hands. So I can move this back because I know I'm going to put some of my equipment in the front. Now you don't have to set it up exactly this way, but you do need to make sure you're staying sterile. So I'm going to go ahead and move this back here. I have my pipettes. You can fold them in half to get more water off the sides, but when you place them down, make sure you're giving some room. I will put the brush in the first one because that's where I'm going to wash it. You have 3 pipe cleaners. I fold 2 of the 3. You want to be careful how you pick them up. So I will make sure I alternate them so that way when I'm picking them up I don't contaminate. And I'll leave 1 hole. Trach ties, I'm not going to test you on trach ties, putting them on and off, but I want you to show me how you do it when you're practicing. So then what we have here is we have 3 sterile gauze. You're going to keep 1 dry and 2 are going to be wet. This is our dressing. What I usually do is I'll fold it in half and I'll fold that over so that way when it goes under I can open it up nicely for the patient. So I will also put that back here. You have 3 cotton tip applicators. You get those wet. Put them back in your first tray. Now when you're putting them in here you want to make sure it's within that 1 inch. So I'm going to take one of these and I'm just going to ball it up, dry, and I'm going to put it down, and then I'm going to take these other 2, just dab them in here, squeeze it out. They don't need to be super moist, but I'm going to put those in here as well. And you wondered why you got so many 4x4s? This is why. So you can have some dry ones to replace these with. Alright, now I'm ready to get started. I'm going to be contaminating this hand, your non-dominant hand, whichever hand that one is for you. So if you're left-handed, it would be your right hand. And then make sure you position yourself on the bed accordingly. So if you're left-handed, it's probably easier for you to come in on the left side. I'm right-handed, so it's easier for me on the right side. Somebody here is left-handed. No? Oh, okay, good.
She just operates left-handed.
I thought somebody was left-handed.
She just operates left-handed, but she's right-handed.
That's good, you're ambidextrous. You can come, because sometimes you don't have a choice. You have to go on the left side. It makes it harder, but always think sterile. So you tell your patient, okay, I'm looking at their pulse ox, looking at their heart rate, looking at their rate of breathing. You're going to remove their inner cannula. They can still breathe because this is the inner cannula. They still have a cannula in there. These are really loose because they're mannequins. But when you take this out, just be really careful not to drag it all over the place. So we're going to go ahead and take this with our left hand. We're going to put it into our fluid. And we're going to let it soak. Now when we pick it up, guess which hand we're picking it up with?
Sterile hand, right
Nope.
here.
Contaminated.